Doctors at Duke Health are working to cut down the time it takes for the smallest patients to get a heart transplant.
CBS 17's Mary Smith shows us how a new technique is offering hope to families on the wait list.
Every year in the U.S., about 700 children are added to the wait list for a pediatric heart transplant, but only about 500 transplants are performed.
If an infant's on the heart transplant list in this country, a third of those kids will not get a heart in time. So this is a very vulnerable population.
Now researchers at Duke Health say a new technique could expand the donor pool for pediatric heart transplants by 20%.
Okay, so it's still very, very young, but it shows a lot of promise.
The donation after circulatory death technique, or DCD, is a relatively new method of transplantation and has only been used in adult and teen patients. However, it needs a perfusion device to assess the heart's functionality, which are too large to fit on infant hearts.
But for pediatrics, especially our smaller children, the babies, there's never been a technology like this.
The donation technique also faces ethical concerns.
One technique has it such that we place them on a support device that helps to bring their heart back inside their body. Now, the concern about that is that could they potentially be giving blood flow to their brain at that point? And that's really where the ethical concern comes into play.
So Duke scientists developed a new groundbreaking approach to overcome the barriers of DCD in infants. It's called on-table heart reanimation. It temporarily reanimates the donor heart outside of the body on a surgical table using a heart-lung machine and allows surgeons to evaluate the organ's viability before transplant.
And it really, is going to help us to be better stewards of these precious gifts of heart donations.
Doctors successfully performed the procedure earlier this year, saving the life of a 3-month-old patient.
Couldn't tell the difference between this kind of heart transplant or any of the normal heart transplants that we do. But really, the innovation here is access.
Mary Smith, CBS 17 News.